Welcome to Attleboro Update. As several dangerous viruses have made news headlines around the world, some fear that disease may spread within the United States. The Ebola virus has gotten much attention as it spreads across West Africa, but there are other diseases of concern as well. Most notable are the Enterovirus and Influenza. Although not expected to greatly impact the United States, the Attleboro Health Department is well prepared to handle infections within the city. To learn more about these viruses and the city's preparedness, we spoke with Attleboro Health nurse Jacquie O'Brien.
Good afternoon. I'm Jacquie O'Brien, the public health nurse of the City of Attleboro, and I work here at the Attleboro Health Department located at City Hall. So we've had questions today about Ebola and Enterovirus. So there's a lot of good informational resources for people. Go into the Centers for Disease Control website, actually go into the Massachusetts Department of Public Health website, and people can also call us here at the Health Department. Again, we all have the same information, and we're happy to share that with the public. People do have concerns, and part of what we do here at the Health Department is we want to make sure that people are informed and that they don't panic. Some of the ways that people can do this are the things that we emphasize every single year. Doing good hand washing, good cough etiquette. If you're home with any type of fever, diarrhea, cough, stay home. Try to limit the spread of disease to other people. Also, common sense things. Making sure that you're eating a good diet, making sure that you're getting enough sleep at night, moderate exercise, and again, making sure you're up to date on your immunization status. That's all vaccines, not just flu vaccine, but all the vaccines. People are immunized from birth to death. And again, the health department has started our flu clinics, and you can always call us for more information about that. What's important for people to remember is they have to come into direct contact with the body fluids, which would include blood, vomit, urine, semen, somebody that's infected with Ebola virus. And again, if they had open cuts on their hands, or if they weren't wearing the proper protective equipment, if they were helping during funeral rites or handling bodies and helping to bury those bodies, and again, we're not wearing the proper protective equipment, those are the ways that Ebola would directly transmit to somebody else and would put people at a higher risk. A lot of times what people have is they'll have fever, they might have diarrhea, they might have body aches. Some people will also have bleeding, which is a little bit more of indicative of the Ebola virus, but again, those are the things that you would tend to look at. If you travel to those countries, it doesn't necessarily mean that you're going to get Ebola or be exposed to Ebola. But again, if you are traveling to those countries, we would ask you upon return to monitor yourself for 21 days. First of all, people should not panic. Again, people are being checked as they're leaving other countries, and they're being checked when they're entering the U.S. borders. If people are coming from West African countries, again, we would ask them to monitor themselves for the 21 days, especially for a fever, a couple of times a day. If they have questions, certainly we would want to hear from them here at the health department. I know our local hospital, Sturdy Memorial, has an emergency operations center, and they have somebody in charge of emergency preparedness for the hospital, that they practice all hazards, not just necessarily Ebola. They prepare all the time for all types of things. And again, we work closely with our local hospital, our local emergency management, and our partners in the community to protect the citizens' health. It's important for people to get any vaccination, again, to protect themselves against disease. Vaccinations are not 100%, but again, they're one of the best measures that we know to protect individuals, especially for individuals that might not be able to receive the vaccine, because not everybody can receive the vaccine. So the more people we have immunized, the better protection we offer the general public. We've started doing our flu clinics. We started in mid-September. We started doing senior housing, and we're currently just, in fact, started today our school-based flu clinics, and our first public flu clinic will be this coming Friday at Jonathan's Cafe here in the city. It's an early morning clinic. We're trying to catch some of the early risers and the people that might be taking the train to, if those want to protect themselves against influenza, we'll be there to offer that flu vaccination for them. We'll have additional clinics throughout the month, and we'll be doing our school-based flu clinics throughout the month also. Well, certainly they're always welcome to call me. They could go to the city website, which is www.cityofattleboro.us/health, and that brings you directly to the health department page. There's a link there for flu information. So there's general information about influenza that's offered by the Centers for Disease Control and the Mass Department of Public Health, and also there is information underneath there for our flu clinic schedule that our MIS department is updating for us as we ask them to. We're also playing it on the local cable, and we're also putting it in the local newspaper. We encourage people again to stay healthy, watch out for each other, and certainly educate yourself to stay informed.